I'm Dr. Warunie, a probation lecturer at the Department of Anatomy, Faculty of Medicine, University of Peroneus. I'm going to present our research on the quantitative characteristics of Peroneus Tertius and Extensor Digitorum Longus, which was a cadaver-based study. First, we'll talk a little bit about the background. The leg has its muscle divided into three compartments: the anterior, the lateral, and the posterior. The Peroneus Tertius and Extensor Digitorum Longus are muscles of the anterior compartment of the leg. Here is shown the Extensor Digitorum Longus muscle, which divides into four tendons and is inserted into the lateral four toes. This is the Peroneus Tertius muscle, which is attached to the lateral aspect of the foot, here specifically to the base of the fifth metatarsal. The Extensor Digitorum Longus is involved in dorsiflexion of the foot, that is, lifting the foot upwards. The Peroneus Tertius is involved in dorsiflexion as well as eversion, that is, turning the foot outwards. This Peroneus Tertius muscle is a peculiar muscle. It is found only in humans and few apes closest in the evolutionary chain. It may be absent in the minority and is considered non-essential by some. It is used extensively in tissue replacement surgeries. So the objective of our study was to analyze the quantitative characteristics of PT and EDL muscles and look for associations and correlations between their characteristics. We used cadavers dissected by medical students according to the undergraduate course under the guidance of the academic staff. The anatomy of PT and EDL were further clearly defined using blunt dissections by the researchers. The standard measuring tape was used for measurements, and minitons of their version 20.1 was used for the data analysis. For this part, we got the help of Dr. Warunie from the Department of Statistics and Computer Sciences from the Faculty of Science, University of Peroneus. We use Pearman raw for correlations, and for associations, we used Moore's median test, Fisher's exact test, and true sample t-test. The sample consisted of 54 lower limb specimens, of which 32 were male. The length of Peroneus Tertius muscle was 20.38 centimeters at average, and that of Extensor Digitorum Longus was 28.83 centimeters. The length of the Peroneus Tertius tendons after its insertion was 21.77 centimeters, and we're taking the tendon length of Extensor Digitorum Longus, we took a fixed point as it divides into four tendons and does not have a specific point of insertion. So this is the lateral malleolus, which is a prominence of the fibular bone, shown here. So for comparison, we took the length of Peroneus Tertius up to the lateral malleolus as well. The muscle belly circumference of Peroneus Tertius was 3.52 centimeters, and that of Extensor Digitorum Longus was 4.18 centimeters. Spearman raw was calculated for the muscle belly circumferences of PT and EDL, which showed a positive moderate correlation. That is, as the size of EDL increased, the size of PT increased along with it. So this goes against the theory that PT is an evolutionary replacement for EDL. Rather, the PT plays a complementary role for EDL. When considering the proximal attachment of these muscles, 26 of the specimens had a continuous origin of PT and EDL. And in 25 specimens, they had a separate origin. And in one of the specimens, we found absence of Peroneus Tertius. In this specimen, we can see intertendinous connections, which are small tendinous connections between the main tendons of Peroneus Tertius and Extensor Digitorum Longus. So these intertendinous connections were present in 16, that is 30.77 of the specimens. Most of these specimens had only one connection between them, and this ranged from 1 to 7 intertendinous connections. Spearman rho was calculated for the EDL muscle belly circumference with the number of intertendinous connections, which showed a mild negative correlation. That is, as the size of EDL muscle decreased, the number of intertendinous connections increased. Therefore, we can assume that the intertendinous connections play a role in distributing the forces between extensor digitorum longus and the Peroneus Tertius muscles. Then we looked at the sites of insertion of Peroneus Tertius. In 2019, Warunie has come up with a classification system. So we included our findings to this classification. Commonest finding was Warunie classification type 2, which is as a single insertion into the base of the fifth metatarsal. So, in addition to these 5 types of classification, we found a few extra types of insertion. We found a slip of Peroneus Tertius tendon extending to the extensor digitorum longus or Peroneus brevis, in addition to the attachment to the base of the fifth metatarsal. So here in these diagrams, we see different sites of insertion. Here, the Peroneus Tertius is attached to the shaft of the fifth metatarsal. Here, it is attached to the base of the fifth metatarsal. Here, it is divided into 2 slips which attach to the bases of the fourth and fifth metatarsals. This is one of the additional sites of insertion we found. Here, we see an additional slip of Peroneus Tertius extending into the tendon of Extensor Digitorum longus. Here we see an additional slip of Peroneus Tertius extending to the tendon of Peroneus brevis. This is the tendon of Peroneus brevis. In this specimen, we see absence of Peroneus Tertius. Next, we looked at the association between gender and the presence of intertendinous connections using the Moore's median test, which did not have a significant association. Then we looked at the association between gender and the site of insertion using the Fisher's exact test, which did not show any significant association as well. Next, we looked at the association between gender and the morphometric measurements using the 2-sample t-test. The characteristics of Peroneus Tertius did not show any significant associations. However, the muscle belly circumference of extensor digitorum longus was significantly larger in the male population. So, in conclusion, the morphometric and morphological characteristics of Peroneus Tertius and extensor digitorum longus vary among individuals. The Peroneus Tertius may be absent in the minority. The Peroneus Tertius and the EDL have a continuous origin in almost half of the specimens. There was a moderate positive correlation between the muscle belly circumferences of PT and EDL. Intertendinous connections were present in around 30% of the specimens. A mild negative correlation was found between the EDL muscle circumference and the number of intertendinous connections. The muscle belly circumference of EDL was significantly larger in males. Thank you.